Hello, welcome to Module 4 Cure, Myths, and Medical Advances. There are lots of noise out there today. Sickle cell is now curable. And when people hear that, it creates hope, but sometimes also confusion. So let's slow down and talk about the full truth, not just headlines or social media captions. Yes, medicine has advanced significantly. There are now treatment options that can potentially cure some people living with sickle cell disease. Some of the major medical approaches include bone marrow transplant and gene therapy. These developments are real, but they also come with important realities people must understand. One of the best known treatment options is bone marrow transplant. In simple terms, doctors replace the patient's damaged blood-forming cells with healthy ones from a compatible donor. That donor can be a sibling or a parent, depending on their age, or a relative. There are full match donors and there are also half match donors. And bone marrow transplant can be done if you have a full match donor or if you have a half match donor. Some facilities specialize in full match transplant, some specialize in half match. The goal is to help the body begin reproducing healthy red blood cells instead of sickle ones. For some patients, this leads to life-changing outcomes. Think of it like replacing a faulty production factory. If the factory producing defective products is replaced with a healthy one, the quality of what comes out changes. That's the idea behind bone marrow transplant. Now, here's the part people don't always mention online: cost and accessibility. These treatments can be extremely expensive. In many countries, especially across parts of Africa, access is still limited. Not every hospital can perform these procedures. Not every patient can afford them. And not every patient can find a matching donor. These procedures also carries risk. For example, the body may reject the transplant, serious infection can happen, the recovery process can be long and difficult. So, while these treatments offer hope, they are not simple or guaranteed solutions. There are also newer approaches like the gene therapy. This is the newest one and it is very effective but different for every patient. Scientists have developed ways to modify or correct genes connected to sickle cell disease. This area of medicine is advancing quickly and has shown promising results in some patients. So it's advisable to talk to your doctor about your options and what best works for you. If you don't have a donor, gene therapy is an option for you. Imagine if instead of replacing a whole factory, you repair the faulty instruction manual causing the problem in the first place. That's similar to the goal of gene therapy. Yes, medical breakthroughs exist. Yes, research is advancing, but many people living with sickle cell today are still focused on something more immediate: how to manage daily life, reduce crisis, stay healthy, and maintain hope. There are also many myths surrounding sickle cell. Let's look at myth number one. People with sickle cell cannot live long lives. That is false, actually. With proper care, many people with sickle cell live productive and meaningful lives. And with the coming of CRISPR, gene therapy, bone marrow transplant, even longer. Myth number two, the cause it is caused by spiritual attack or curses. This is mostly believed in the African culture, the African setting, which is false. Sickle cell is a genetic condition inherited from parents. It is medical, not mystical. Myth number three, if someone looks healthy, they must be fine. Not always. Many people living with sickle cell learn to hide pain and push through difficult days silently. For many families, this conversation is emotional. It was emotional for me for a long time till I finally built the courage to talk about it. Some are praying for cure, some are trying to afford treatment, some are simply trying to survive one crisis at a time. So when discussing cures, compassion matters. Medical science is evolving quickly, but while research continues, people living with sickle cell still need support, understanding, proper healthcare, and encouragement today. Medicine is evolving, but life is happening now. And beyond the physical pain, there is another part many people ignore: the emotional and the mental impact of living with a lifelong condition. Let's talk about that in the next video.